Hi, folks. My name is Dana Finnegan. I'm the Director of Market Strategy at MDaudit, and we're here because we're all hearing so much about CMS rolling out a very aggressive strategy to scrutinize Medicare Advantage plans. Specifically, what we've heard about those risk adjustment data validation audits, or RADV audits. Now, we know it's the Medicare Advantage plans being heavily scrutinized. We know you folks at the healthcare organizations and compliance are doing the right things. But with all that scrutiny, it'll touch you as well. So we want you to be able to use MDaudit to go in and really audit your diagnosis codes and HCCs. So we're going to show you how you can do that. I can do that on both the professional side. I can do this on the facility side as well. I can even go in and do this prospectively or retrospectively. It's really up to what your program wants to do. But let's show you how you can go in and do that. I'm going to grab Dr. Smith. I'm going to put in his rendering NPI. So I want to see how he is billing those HCCs or how those are being coded for Dr. Smith. So I put in his NPI, but more importantly, I'm going to be able to go to my diagnosis section and grab any diagnosis codes I want. Today, we're going to grab HCCs. You can see we have version 24 and 28, but I'm going to go in and say, show me where that HCC category is in this list. And I'm just going to, once and I can even go in here and say, show me when that was billed to certain payers, in this case, to my Medicare Advantage plans or wherever I want. But once I hit these arrows, the system is going to pull all of that data I asked for. It's going to automate that data pull. You can see it found 1,000 claims. I'm going to go in and put a sample size of 10 so I get a truly random sample of what I've asked for. Now, when I hit continue and create that audit, all of that's been automated. So as the auditor, as the compliance stakeholder, I can go in here and just concentrate on, are those diagnosis codes and are those HCCs going to my Medicare Advantage plans appropriate? And you can see here, MDaudit is putting that data together. And now I have my work queue of 10 cases, and I'm actually going to go in and we're going to take a look at what happens next. We won't go through a full audit. But what I wanted to show you is you'll have a great view to see, here are my diagnosis codes, all here. But more importantly, it's going to point out those that are HCCs. And I can go in and say, hey, I agree with this one. It was coded to the highest level of accuracy and integrity. But for this one here, I've reviewed the documentation. I feel like a different code is more appropriate. So I'm able to go in and actually edit that. And you can see it saying I-73.9. In my opinion, after the review of the documentation, I feel this is an I-79.89. And I can put in that supported value. I can put in my audit finding. I can even communicate why I've made this change. Or I can send something to my coder, whoever I want, to say, please review this change I've made. And when I go in and save that, it's going to turn it red meaning I've made a change. So what you're seeing here is the ability for us to do all the data pull for you. So you're going in and auditing your diagnosis codes and specifically those HCCs. So when they are sent to your Medicare Advantage plans, they're spot on. We've got you covered. Now, as good of a job as you folks are doing to make sure those codes are going out appropriately, we always know that you could receive ADRs from Medicare Advantage plans, from any of your payers, really, to say, send us your medical records. We want to really see if these HCCs and diagnosis codes are coded appropriately. I have just a random ADR on my desktop here, but we're going to use it in a moment. So what we want to show you is when you do receive those ADRs, you can very easily come into MDaudit and scan them. And I'm going to go and browse and look for that letter that I just showed you. And I'm going to scan it. This allows me to use what's called Smart Scan AI to scan that letter. You folks don't have time to be entering all this information manually. You can see it's scanning it right there. You got to concentrate on responding back and providing those medical records and all the documentation supporting your diagnosis codes and HCCs. So by us scanning this letter, which we are doing right now through optical character recognition, it's going to do all of that work for you so you don't have to do it manually. And folks, you can see MDaudit has now scanned everything that was on that letter and taken it off for you. You can see all of these attributes have been ripped off of that ADR letter. Now I can go in and search cases. When I do that, This will now find all of the claims and remits associated with those accounts that are under scrutiny. And I'm going to add all of that into my audit. And when I close out and save, what you're going to see here, and it was accomplished in just a few clicks, was I'm in the initial submission round, in this case with the RAC, it could be the Medicare Advantage plan, it could be Blue Cross, but all of this information up top from left to right that I am now kind of scrolling through has all been entered for you. And more importantly, we pull the total charges from the claim and the payment amount from the remit. This is the payment amount that's essentially at risk. But from here, you can start responding back to the payer immediately, so you're in the driver's seat to really retain more revenue and refund less. So at the end of the day, folks, we've got you covered on the front end where you can easily pull your diagnosis codes and HCCs, but also on the back end if you ever have to defend them. And hopefully we can show you more. If you'd like, come back and talk to us. But thank you for your time.